The hospital study is really for anyone in healthcare. The main audience, and those that I think will get the most value out of the hospital study, are those that are working in a hospital, thinking about hospital priorities, and then serving hospital customers. And so, as you can imagine, that's almost everyone in healthcare.
Health systems are running into challenges that are operational and financial right now. They're under severe pressure as their costs skyrocket. They are facing enormous staff shortages. They are struggling with the financial implications of all of that while reimbursement adjustments are lagging. And
hospitals don't have, certainly nurses, doctors, broader clinical staff. That has become their number one priority. Now, hospitals are mission-driven organizations. They're here to provide care to patients, and so quality of care continues to be their biggest mission, and that shows up in the survey as well. But interestingly, all of the metrics that they point to for quality of care are around things that are measured in value-based care programs.
What we have found is that any kind of care provider really wants to be able to create a more effective and efficient healthcare system, and they realize that digital is the way to do that, or at least part of the way to do that. But however, they don't have the same capabilities that a medical technology company or a tech company or a pharmaceutical company does in really understanding what that means.
I think a second point that has come up is the role of resiliency. Supply chains had optimized historically around cost reduction, and that created significant risk in most supply chains. That has resulted in health systems reevaluating different methods and approaches for controlling the supply chain better so that they have more resiliency. We're seeing more interest in self-distribution capabilities, whether it's just having warehousing or actually having a whole fleet of trucks delivering things, to consolidated services centers being stood up or at least evaluated right now.
So where the industry goes from here, I think it's going to be even more important than ever for medtechs to really understand the segmentation of their customer base. Who is still focused on innovation? Who's moving towards value-based care? Where is there opportunity to partner more deeply? Where are there pockets for better pricing versus where do you have to kind of take a longer-term partnering mindset with health systems? That's going to be really critical for medtechs to take into account, and taking a more nuanced and stratified strategy towards their customers, more important than ever.